Hi everyone, my name is Patrick Chu. I'm the policy lead at ARNBC, and I want to welcome all of you to our webinar today, which is focused around the Nursing Practice in Rural and Remote Canada 2 study. So the Nursing Practice in Rural and Remote Canada study, RN2, is a multi-method study focused on providing a better understanding about the complexities of a remote nursing practice, as well as the personal, professional, and community factors in recruiting and retaining all nurses in rural and remote communities. Between 2012 and 2016, RN2 embarked on 4 major research, which included analyzing the Canadian Institute for Health Information's nursing database data, analyzing policy documents, conducting a national survey of nurses in rural and remote areas across Canada, and producing and distributing knowledge translation materials that purport the studies, with the goal of practice to access to care in rural and remote Canada. Specifically, the national survey highlighted specific findings from each, and today we will be BC findings. So we have with us Dr. Martha McLeod, who was one of the principal investigators of this presentation. Martha comes from a professional and practice background in nursing management and continuing education. She is of Northern British Columbia since 1994 and is a professor in both the School of Nursing and the School of Health Sciences. She is currently the UNBC Mobilization Research Chair and co-lead of UNBC's Health Research Institute. Martha teaches in the areas of leadership, qualitative research, knowledge development, and moving knowledge into practice. Martha leads the Rural and Northern Practice Research Team, and her research, broadly speaking, takes a qualitative approach to examining health services and human resources. Specifically, she studies the nature of everyday experience and practice, and how professional practice may be developed or hindered within healthcare organizations, particularly those in rural, remote, and northern settings. She has published and presented widely on rural and northern nursing issues, nursing practice, education, knowledge translation, and network development. Currently, Martha is undertaking partnered research with BC's Northern Health Authority in primary healthcare, and she is active in national and provincial research and knowledge translation networks. And Martha is also a member of ARNBC's Rural and Remote Nursing Policy Table. So we're going to let Martha deliver her presentation for about 40 minutes, and we'll address questions. We'll dedicate 20 minutes to that. Just to let you know that if you do want to ask questions, please type your question into the little taskbar that's located on your screen. Midway through that taskbar, you'll see a tab that says questions. So just double-click on that, type your question in. We'll read it out loud at the end, and Martha will be able to address that question. So I'll hand it over to Martha.
Great. Hi, folks. I'm delighted to be able to share this work with you today. It's really an exciting study from our perspective, and I want to acknowledge again that the funding came from the Canadian Institutes of Health Research. And we were asked to do this study again by Health Canada after about a decade after our previous one. Just going to give you a little bit of an overview here of it. Let's see. It's not progressing, Patrick. Let's see. Could you just put the next slide forward, because for some reason, oh, there it is. Okay, we've got principal investigators and our principal knowledge user. We've done this together with our knowledge users. Oh, and they have been, you can see as we go across the country, we've got co-investigators, which are who are researchers from right across the country, and we've got our research team, as you can see in this slide, right across Canada. We've got our advisory team members, and Penny Anguish here in BC is our leader. We work with Carla Biagioni from the Ministry of Health, Becky Palmer from the First Nations Health Authority, and Kathy Ulrich, who's CEO of Northern Health as well in BC, and there are others across the country. We have research staff and students working with us, what this comes from is our first study, which you might know about. We call it the RRN1 study. It would happen between 2001 and 2004. And that was about the nature of registered nursing practice. It was fourfold: the survey of registered nurses, the registered nurses database, and we were the first ones to do that analysis of the registered nurses database from a rural perspective. And since that time, CIHI, Canadian Institutes of Health Information, which is where our registration data goes, and it's all collected together with all the other provinces and it comes from our ARNBC data into the registered nurses database. We did a narrative study and interviewed 150 people across the country, and we analyzed the documents. Our survey with registered nurses was 68%, and that survey results really then did put on the map the complexity of rural and remote practice. Now, what I want to mention is coming out of that survey in British Columbia is I was asked to present to the chief nursing officers of BC, and they were struggling at the time of how best to support rural and remote nurses. This is in 2004, 2005, remember. And what they did was they had a further study, and some of you may have been part of the interviews. They interviewed a further, Liz Lindsay was the person who took it up and was hired, and she interviewed over 200 other nurses across BC in rural and remote communities, asking what were the key issues in their practice and what kinds of education would be helpful. Out of that came a pilot project, an action research project that I happened to lead about what kind of education would be there. And Liz was key in that, along with all the chief nursing officers who guided it. And there was a partnered education program put into place called the Rural Acute Care Nursing Program, and it came out of UNBC, but it was partnered with all the health authorities, and that is now evolved into the Rural Nursing Certificate Program, also, and it's being base funded, and it is at UNBC, but in partnership with all the health authorities. And so that came out directly from the RRN1. Now, again, as I said, we were asked by Health Canada to give an update. And the RRN2 study, which has been going between 2012 and 2017, is looking at nursing practice in rural and remote Canada and how access can be enhanced. Now, what we are looking at now is all types of nurses, which is the practical nurses, the licensed practical nurses, the registered psychiatric nurses, registered nurses, and nurse practitioners. This map is still there. The census metropolitan areas and central census agglomeration areas have changed slightly, but you can see that the green is largely rural and small town Canada. That piece in Alberta that's a little different is where Fort McMurray is, and it's how the boundaries are drawn. So we wanted to expand the first study and update the nurses database, because now all of the types of nurses are in the database, and we updated the policy document. And we were asked, and we have done a greater focus on primary health care, because one of the things we discovered a decade ago and has been put in there is indeed that they are primary health care is a larger focus in rural nursing practice. So You can see that the purpose of the study is to describe the regulated rural and remote nursing workforce in BC. That's what I'm reporting on today. So I'm focusing on who are the rural nurses in BC, where do they work, what is the scope of practice of rural nurses, and what are the career plans. Now, you'll see that my slides include all the types of rural nurses in BC. And the reason that I'm doing that is a couple of reasons, and I'll come to it as we look at the slides here. The survey was a national survey, a mailed survey with option for online completion, French and English, with persistent follow-ups, and we sent out over 10,000. We had a response rate of 40%, and we think that this response rate is less this time because people are now used to filling out questionnaires. We were surprised that over 80% of the nurses sent back the questionnaires in paper form, even though they could put it online, fill it out in line. So when we talk about the national numbers, you can say that with over 99% confidence that the rural Canada nurse respondents, and that's all types of nurses, are representative of rural nurses as a whole. Now, when we look at the BC response rate, we sent out 764, and you can see that we had 311 return with a response rate of 40%. Now, what that tells us is we have to ask about what's our confidence in being able to speak about the findings. And we know that for all the rural nurses in BC, our sample, we can speak about with 99% confidence that the sample with 90% confidence, the total sample is representative of rural BC nurses as a whole. Our rural NPs are with 99% confidence of the nurses rural BC NPs as a whole, but we can only say with less than 85% confidence that the separate samples of rural RNs, LPNs, and practical psych nurses are representative. So that's why when I talk about rural nurses in BC, it may be rural nurses as a whole, and you can see the numbers of people that have responded here. These individuals are identified through their CRNBC registration as living and working in a rural area, which is 10,000 or less outside the commuting area of a major major city. So who are the rural nurses? Okay, now we've got to remember that the population of BC is over 4.6 million, mostly concentrated in the south of the population. And the rural and remote nurses are 7.2% of our rural nurses, but they care for the almost 12% of the BC's population that lives in rural communities. So our proportion of rural nurses to our proportion of the population is reasonably low and lower than in other areas of Canada, in many other areas of Canada. So the age and gender, you can see that 6.3% of rural BC nurses are men, and the proportion of male RNs in BC, which is 5.2%, was lower than for rural male RNs overall, 6.2%. Conversely, there are more male LPNs that responded. So what we see, though, is that the ages are consistent with those seen for rural nurses in Canada overall, and we find that the nurse practitioners are a little older than the rural RNs, LPNs, and RPNs. So you can see the bolded, if you can see that on your computers, the bolded areas are the ones that are of more interest. They're not necessarily significant because of our numbers, but you can see they are of interest. So younger LPNs and older RNs. So where do rural BC nurses come from and where do they work? We're finding that in the medical literature, in the medical human resources literature, it's really well known and solidly found now that if med students grow up in, rural doctors grow up in rural communities, they're more likely to live and stay in, be recruited to and stay in rural communities. There's never been that information solidly for nurses. Our study does, both last study and this study, solidly say that's the same for registered nurses and for other kinds of nurses, but registered nurses too. So what we find is that over half of rural BC nurses grew up in a community with a population under 10,000, and 64% of the nurses were living in their primary work community. And there's daily and weekly travel. And I think those people who are living in urban areas will say we'll travel as much, but nevertheless, that's the kind of thing that we're seeing here. In Canada, 68% of the nurses in Canada overall grew up in a community with a population under 10,000. I think this notion of rural nurses moving, rurally growing up nurses moving into rural communities as adults is something that we've got to keep an eye on, because the population of rural communities is decreasing. Therefore, the pool of potential people to come into nursing from rural communities is also decreasing. So, who are the Indigenous nurses in? We've done just a little bit of the looking at the Indigenous nurses, and these are self-identified Indigenous nurses, and we cannot respond to this with anything further because fewer than 6% of the rural BC nurse in our sample self-declared as having First Nations, Inuit, or Métis ancestry. And you can see how many there have self-declared. And we're doing an overall report on this group of individuals. Highest nursing education credential. What we're seeing is that the entry to practice requirement of a baccalaureate is making a difference. And so it has changed over the last decade. And looking at credentials, the diplomas, 67% in nursing and 26% in nursing was there. We've got, you can see the rural BC versus rural Canada. And what we see as important is that in BC, over 10% of our rural RNs in BC who responded held a rural and remote certificate, and it's a way greater proportion than for rural RNs in Canada overall. So that education program that came up from the previous study and was developed by the chief nursing officers across BC is certainly making a difference there. So where do rural nurses work? You can see that 40% of rural nurses work in communities under 5,000 and 92% working in nursing. The others are on leave or retired and occasionally employed in nursing. So we have the Canada overall, it's very similar to these numbers. So what kinds of positions? Permanent full-time, 43%, and permanent part-time, 36%, and casual, 25%. Overall, 54% in Canada held full-time positions and 16% held casual positions. So in the BC context, it really is quite, we've got more part-time and casual work positions in BC. And what's interesting is in the rural BC nurses, compared to all BC nurses, which is the orange, and all in rural Canada, which is the red, more are working in community and in nursing home long-term care and in others. So our we've got our, in terms of percentage of our rural nursing population, we've got more working in community than in the all BC nurses and similarly across Canada with the rural nurses across Canada. So how satisfied are people? It's interesting to see that BC nurses, the majority, are satisfied with their primary work community. Now, most research that you see only deals with satisfaction of the work environment. Are you happy with your nursing practice? Are you happy with your employment situation? Are you happy with the wards on which you work? Because of the permeable barriers between the workplace and the community that rural nurses experience, we find that satisfaction with the work community is really important. We ask about primary work community because some nurses work in more than one rural community. You can't just work in 2 units in 2 different hospitals or 2 units in the same hospital. You sometimes need to work in more than one community if you've got part-time jobs and you need to have more employment. So that's why we ask about the primary work community. And it's really quite good that most people are satisfied, and then a good number are neutral and only a few are dissatisfied. And the satisfaction, by the way, is higher in work community in BC than it is elsewhere. So we then look at the satisfaction with current nursing practice, and the majority were satisfied with their practice at 77%, but there were more unsatisfied with their current nursing practice than there were with the community, and the number neutral is not all that different. What's interesting is you can see, even though the numbers are very small, the satisfaction is highest with the nurse practitioners. Nurses, the RNs and LPNs are quite consistent here. So we then move to the scope of practice. And the scope of practice, we ask the question, do you feel you're working within, above, or below your scope of practice? And we're in the process of trying to predict what predicts nurses perceiving themselves to be working within, below, or above. But we haven't got that analysis quite done yet. But this just tells you is that rural BC NPs, 100% said that they were working within their registered or licensed scope of practice. But rural Canada NPs, only 83%. 90% of rural BC RNs said they were working within. 84% of rural Canada RNs said they were working within. 78% of rural BC LPNs said they were working within, and rural Canada LPNs 77%. So that's very consistent across the country. And psych nurses in rural BC said 78% were working within, and rural Canada RPNs across, that's the 4 western provinces, 90%. So what you've got is 11% said they were working below, 4% above, and most of the people thinking that they're working below are LPNs. So in terms of this, is very consistent. And actually is more positive in terms of feeling they're working within than across the country. Okay, so we asked a series of questions getting at what scope of practice is really, really difficult, extremely difficult. And what we asked about is, what are you responsible for? Okay, what are you responsible for? And so we identified that you can see we've only got the rural BC nurses and rural Canada nurses. So this is all rural BC and all rural Canada. And BC rural nurses were slightly less engaged or less involved in promotion, prevention, and population health activities compared to rural Canada overall. We've got therapeutic management, and you can see that the rural NPs, generally a wider therapeutic management responsibility for BC NPs, these kinds of things that you see. By the way, these are in more detail in our BC fact sheet on our website. When you look at leadership, the leadership of involvement of rural BC RNs and LPNs. Rural BC RNs identified being more engaged in leadership responsibilities than rural LPNs, which is quite normal, especially for mentoring nursing students and colleagues. So, interprofessional practice. Who do rural nurses in rural BC work with? And we don't show a number of people on the graphic. We only go for those who are the most frequency, which are over 20%. So you see that over 20% of the rural nurses, 311 of them answered this question, worked with Aboriginal or community health workers, security and police services, paramedics, specialist physicians, public health nurses, social workers or social service workers, mental health and addictions counselors, home care nurses, OTs, dietitians, LPNs, physiotherapists, pharmacists, RNs, and family physicians. Now, the people that did not, were working with fewer than this, were RPNs, which was under 20%, and I'm just going down the list from 19% down to 2%. RPNs, nurse practitioners, dental hygienists, midwives, dentists, others, clinical nurse specialist, environmental health officer, alternative practitioner, physician assistant, and Aboriginal healer. So people did talk about it, people did mention all of these, but 20% or more are working with these individuals here. So the interprofessional team, as we're talking about interprofessional team, I think we need to look at an interprofessional team in a much more broad sense than we have before, than we normally do in nursing. For instance, in the qualitative data that we asked at the very end of the questionnaire, we asked people, what does it mean to be a nurse in rural and remote communities? And in the BC data, 2 nurses talked extensively about how they work with the RCMP. And that's where you get the security and police officers in the small communities. Okay, so we asked the questions about their perspective of primary health care in their workplace. And we asked the question about how engaged is your workplace in these various things. And you can see that the blue is rural BC nurses and rural Canada nurses overall. And what's interesting is, and these are nurses in all workplaces, that we found that BC nurses were slightly less engaged than rural nurses across Canada in these areas. But our most 4 out of 5, these nurses are they were Likert scale. Out of 5, how engaged is your workplace in these things? So patient-centered care was most interdisciplinary collaboration, comprehensiveness of care, accessibility and availability of care, quality improvement, continuity, equity, population orientation, community participation, and intersectoral team. Now, what's interesting about the intersectoral team, because it's the least engaged with primary health care principles, was essentially with that one is that we get information and we share within our workplace, but not beyond our workplace. So that being able to work across sectors with community services and hospital services and such is not fully present yet in BC or experienced by rural nurses in BC. Okay, recruitment. What brings rural BC nurses to their primary work community? And this is an ongoing challenge. And what's fascinating is the location of the community was one of the biggest issues, most influential. Interest in the practice setting, next, and the lifestyle. Only 39% of rural nurses in Canada overall identified lifestyle as a recruitment factor. So in BC, lifestyle is a big issue for rural nurses in BC. Friends or families, 36%. In some communities, particularly in Eastern Canada, that was a larger focus for rural nurses. And income was another. And in Northern Canada, income was ruled higher, family or friends ruled much lower. So advanced practice opportunities was about 21% of nurses talked about advanced practice opportunities as an influential recruitment factor. Flexibility of work, about 26%, and the spouse employment or transfer, 26%. And I expected there to be, given the last research, I expected there to be more about the spouse employment and transfer, but it was only 26%. Okay, so then we said, why do you stay? What keeps you in the community? And rural BC nurses continue to work in their community because, very similar to the other one, location of the community and interest in the practice setting, lifestyle factors, and income. But you'll see there's differences in RNs and LPNs. And the blue is the RNs and red is the LPN. So what this identifies is a difference in what keeps people in rural communities and how we may need to differentially support RNs and LPNs going farther. The practice setting interest is a big one, and that comes across with RNs and with nurse practitioners across the country as being important, more important than to the LPNs. The LPNs often find that the income is more important than the benefits type things are more important. That's consistent pattern across the country. So what are the career plans? 33% of rural BC nurses were planning to leave their present nursing position within the next 12 months. That's 1/3 of nurses said they were planning to leave their position. The turnover is huge, and that intention to leave is huge. That's highly significant, and that is not. So we asked what their career plans in next year, in the next 1 year, and then again in the next 5 years. And most often, they said that they were going to relocate within Canada or retire, but then some also said they plan to go back to school or nurse in another community, and another rural and remote community. And I think, and these are the percentages of those who said, the 33% said they were planning to leave in the next 12 months. And then we gave them a list of why are you intending to leave, and this was what they had to say. So I think that the retirement is high within that next year, but the relocation is also very high, and that turnover. Now, most of the people who intended to leave were RPNs, and then the least were nurse practitioners. And overall in Canada, the nurses who intended to leave were 26%. So BC had that higher intention to leave in the year than did nurses across Canada. Okay, so then we said, what do you intend to do in the next 5 years? Now, what we found out that the number of people who intended to retire in the next 5 years ranged from 19.5% in Quebec to 34% in Saskatchewan. So we said, what are you intending to do in the next 5 years? Do you intend to leave? And then of those who said yes, they intend to retire in the next 5 years, this is what of those 5 years. So we found out that nearly 26% of the nurses that we surveyed intended to retire in 5 years, which was consistent with the numbers who were planning to leave in 12 years. And you can see that this is not, this is different across the country, and we are sitting not too close to the lower end. Okay, so what are the career plans? So rural BC nurses who intended to leave their current nursing position within the next 12 months, we said, what would help you consider to continue to work? And of those who said they intended to leave but would consider to continue to work, they said, those who said yes, they would consider updating skills and knowledge, have increasing flexibility in scheduling, receiving an annual cash incentive, using more of their skills, and then access to online education were those, that was what they said they wanted. The updating skills and knowledge and access to online education. People indicated that the Rural Nursing Certificate Program, and they did mention that in the last, what does it mean to be a rural nurse? And they said that was a very positive thing. But the other thing that they indicated was that they couldn't get off their units, or they couldn't get supported to go to these things. They couldn't get the structure around them couldn't allow them to go. And the LPNs as well indicated that that was a big problem for them. So there's a few quotations. We've got, we had about 209 nurses also commented on what it was like to be a rural nurse. And in BC, like elsewhere, it says being a rural nurse means to be constantly challenged, maintaining flexibility and creativity. The idea is it can be difficult when you know them on a personal level, because there are times where you've got to be a nurse and not the mother. You have to be the nurse and not the friend, and it may change the relationship. So you've got to always anticipate the worst and be prepared for changes. Now, the other notion is that there's no teams that'll come to your rescue when you're struggling, and you've got to pull out your creative side. You've got to make shift, and it can be very stressful but also rewarding when you give that care and are trusted in the community. And these are two very typical quotes. We're analyzing all of this data right across the country, and we're doing it province by province, and then and territory, and then we're going to be comparing them across the country to see are there similar themes and perceptions that are coming out across the country, and where might the variations be. So, our conclusions. We've got, in 2015, 7.2% of BC nurses cared for the rural population, almost 12%. And 6.7% took care for the rural population in 2010. So you see that proportion is better than it was in 2010, but it still is very low. A quarter of BC rural nurses hold a casual nursing position. The vast majority of BC nurses work within their scope of practice, and we then identify that the interconnection of the workplace and the community, focusing on the patients and the people of community, is really there. And so rural and retention activities need to really interconnect the nurses' workplace, their personal lives, and the community lives in which they work. So, contact information, you'll see us, but take a look at the website, unbc.ca rural-nursing. And if you put in rural nursing UNBC into Google, like I end up doing because I can never remember this, it comes out as the second or third, the first, second, or third thing that you can put in. So under publications there, you can see the BC fact sheet and the analysis of the database and the overall reports. So now I'd like to turn it over to questions.
Thanks, Martha, so much for that presentation. And just for the people who joined us later on, if you do have a question, please type it into the taskbar that's located on your screen. Midway through that taskbar, there's a little tab that says questions. And we'll read it out loud for Martha to. So, I don't see any right now, but I'll give everyone a few minutes if you have any questions. Then. So one of the questions is, how do we enter the intersectoral environment in the rural and remote community?
Okay, now very the intersectoral. Okay, so just think about the various sectors that we as nurses learn about in terms of the social determinants of health. And that has to do with working with the police, with the social work environment, Ministry of Children and Families, and all of the community services that may be in our various communities for people. So how do you start to work that, make those connections? There's a few ways. One is in terms of the workplaces. Many of the rural nurses are on various committees within their workplaces. And it can be as much as you look at, we're going to be changing some of the policies or practices in our, if you're in an acute care, in emergency department, thinking about what other organizations outside the hospital might help us to think about the caring for our patients and families in a different way. And inviting somebody, just cold call. Many rural nurses already know the others. They also have multiple roles. They play multiple roles. The people in the recreation departments may be able to be connected. So that kind of interconnection can happen. Another way that the interconnection can happen is all the many people who work in community health and the new initiatives that are happening across the province in primary health care and integration around primary care homes and integration of interprofessional teams around primary health care homes. And nurses are in an enormously influential place in that. In terms of if you're working in long-term care, the identification and remembering that the people in long-term care are residents of the community. And are there some connections that can be made in some of the comments that were made in what it means to be a rural nurse is saying we just don't have the time to engage with our communities, and our residents haven't been out of here in a long time because of transportation issues. Now, I know that this it can happen within a residence council or a family council, that kind of discussion can be initiated, and then if somebody can pick it up and take it farther, the Kiwanis or the Rotary in a community can be very helpful. And one of what keeps coming to my attention is how these kinds of groups haven't even thought of engaging with the nurses. And if the nurses can make the first connection, I think it might be very helpful in that way. And the last thing is policy. We've identified a number of different ways that nurses are in an absolute prime position in their communities to influence health and community policy, both at the municipal level, and at the provincial level, most directly, and also at the federal level. But taking a look at the municipal level, what are municipal services contributing to the health of your patients, and is there anything that you can identify that might be helpful or advocate for? And the public health nurses have long talked about that, and have been part of committees that have advocated and changed to become healthy communities. And I think that's the kind of place. So those are is starting with where you are, keeping the patient and family focus and your great knowledge of patients and families there, and then saying, okay, who else in this community and beyond can contribute to the health of our patients and work with us on it.
Thanks so much for that question, and thanks for your response, Martha. Are there any other questions? I'll give it a minute or two for anyone who wants to type in their question.
I've got a question for that people might be able to comment on, um, and that is what I'm saying. Does it resonate with your experience in your communities and perhaps yourselves? And if, as we as our researchers work together, um, what part of the challenge when you do this kind of research is answering the so what question. And I think this, how do we enter into the intersectoral, is really helpful because it helps me to think as a researcher, okay, uh, when we work up more of our analyses, and we've got lots of analyses to go yet, um, what how can we focus it so that the questions of the rural nurses can be answered in a way that's really useful? So I guess that's my question of this group is, are there any other questions or analyses that this information has sparked an idea with you that if we can follow it through, I would like to know about that.
So if the participants on the line want to type in any comments or even send any comments to Martha around her question, that would be great. But if there aren't any other questions for today, please feel free to come back and check the ARNBC website. We will be posting the webinar and archiving it, and you will be able to access those links that Martha mentioned earlier on in the presentation. And if you have any questions or concerns, please feel free to email me, Patrick Chu at pchiu@ARNBC, and I can direct you to the right person or answer your questions as well. So if there's no other questions, I would like to thank all of you for joining our webinar today. Thanks so much, Martha, for your presentation. It was very insightful. And I look forward to having all of you join some of our other webinars that we're going to hold in the future. So thank you.
Thank you.
Thanks, Martha.
Thanks.